COVID-19 is a gruesome virus that has wrecked the country during the second wave. The catastrophic overload of medical facilities has doomed the country and was going to leave an unimaginable scar on the people. Caritas India, following the strategy of be informed, be trained, be connected, be cautioned, and be compassionate, exercised a preponderance of work in the recent COVID crisis that struck India dreadfully. Along with its diocesan social service societies present across the country, Caritas India initiated the COVID relief services to strengthen the health infrastructure, humanitarian relief, and community awareness.
COVID-19 pandemic is a huge humanitarian challenge which needed unprecedented response. In the first wave of COVID pandemic, Caritas India reached out to 22 million population, serving the community with food, medicine and shelter. The second wave of COVID pandemic was even more deadly, which needed more focused and concentrated efforts to save lives of people who were battling for oxygen and for other medical support systems.
Caritas India directly implemented the humanitarian response in collaboration with our local partners and institutions. The organization has set up 69 medical centers in 17 states and union territories across the country, which include 14 first-level treatment centers, 55 second-level treatment centers. First-level treatment centers were devised for patients with mild symptoms that need to isolate themselves. The second-level treatment centers, through and within hospitals, were initiated to expand and address the rising cases of patients with provisions for medicines, beds, and equipment for healthcare. These centers provided well-rounded care with food and nutrition, medicines, and regular checkups by doctors and nurses. With timely and adequate treatment, we have saved the lives of 144,098 patients.
They have given the instrument, beds, they had provided even ventilators and even the beds, pulse oximeter and the pulse oximeter and even very instruments what was required during this pandemic.
To a certain extent, with the help of especially Caritas India and other NGOs and funding agencies, we could do better.
Apart from medical support, recreational activities were organized. The food arranged for all the patients was rich in protein. Till now, 21,385 admitted patients have received food service in the centers. This extensive support and care to the patients was made possible due to the tireless efforts of the staff, doctors, nurses, volunteers, and various other stakeholders involved. The Church Congregation, Catholic Health Association of India, Catholic Relief Services, and Diocesan Social Service Societies, Caritas India, united with the hospitals to support the medical infrastructure. To relieve the burdened hospitals in some locations, the Church has relinquished its institutions to set up medical centers. In order to strengthen the hospital infrastructure and set up the new treatment centers, oxygen cylinders, concentrators, ventilators, beds, ambulance services, medicines, PPE kits, etc. were put in place. Another major intervention was of setting information support centers to provide updated information about bed availability in hospitals, ambulance services, vaccine registration, and COVID appropriate behavior. Some of the information support centers are operational in Kerala, Chhattisgarh, Uttar Pradesh, and Maharashtra. Our mobile clinics initiative, which gave home based care to COVID affected patients and has aided with the treatment of 26,874 people. These people were either living in outlying places or were hesitant to visit the hospitals. As the majority of the impoverished people lost their livelihoods because of the lockdown and struggled to meet their basic necessities, Caritas India bridged the gap by reaching out to 42,364 people with food kits and 32,278 with medical kits. Medical kits were given to ASHA workers, ICDS staff, local panchayat members, and other stakeholders involved in the COVID special duties. Caritas India, along with Catholic Relief Services, has initiated the Risk Communication and Community Engagement Program. Caritas Samaritans, to be assigned to risk communication and community engagement, worked on sharing information and advice among communities, mitigate rumors, involve communities in response to the pandemic, and inform decision making related to personal risk. More than 8,000 volunteers have been engaged in treatment centers, distribution of kits, spreading awareness, and dead body management.
It is with a deep sense of satisfaction and joy that I greet you today. During any calamity, natural or human-made, Caritas India strived to be a truly humanitarian organization, totally committed to reach out and bring human care and support to the poor and the most needy people of our country. Truly, Caritas is the joy of service,